Hello, Ms. Hanson. My name's Shelly. I'm going to be your student nurse today. And first of all, we're going to change your dressing on your abdomen. In the past, have you needed pain medication for that dressing change? Okay. Are you allergic to iodine or any type of tape? Okay. So you want to gather all your supplies, check your doctor's order, check your patient. So I'm going to check the patient's armband when I go back in and make sure I have the correct patient. Ms. Hanson, I need to see your armband and your date of birth. Okay. So you want to just uncover the patient the least amount as possible. Just you want to uncover what you're working on, but nothing more unless you have to. So you want to make note of the dressing when you look at it. And there should be a date and a time on it telling you when it was changed last. Put your gloves on. Okay, so I'm going to remove the dressing. Depending on the patient's skin, you may have to hold the skin as you're taking the tape off. Just be aware and cautious of that. And you want to notice any drainage, odor, or anything on the dressing, because you're going to document that later. Remove your fluorophores. Then you're going to assess your wound. You're going to look at the size. You would measure it, the length. And so you can document all that later. You're going to get rid of this and remove your gloves. You're going to perform hand hygiene. Then you want to get all of your stuff close before you get sterile. So you want your trash can close and your table. You're going to open your dressing. Open away from you. Sometimes it does not open perfect. You just leave it as it is. And you're going to don your sterile gloves. You can do this on a different part of the table, or you could put it on top of your dressing, as long as you don't mess up your sterile field. When you're putting these sterile gloves on, if you'll try to separate your fingers before you actually try to put your fingers in the holes, it will make it a little easier for you. So once you get your sterile glove on, you have to keep that above your waist. And the second glove, you can touch the inside with the glove. Again, try to separate your fingers. Make sure you got your fingers going in the right hole. And you can get rid of that with your sterile drape. And you want to set up all your supplies. I just kind of try to spread this open so you can drop dirty things in it without touching anything. Okay, in the hospital, if the patient's not allergic to betadine, we would use the betadine swabs. There's 3 swabs in the package. For the purpose of the video, we're going to use the Q-tips. And you're going to clean the wound from the cleanest portion to the dirtiest with 1 swipe per Q-tip. You're going to start on the inside, swipe, get rid of that one, get a clean Q-tip, and you're going to go on the outside of that where you just swiped, get rid of that, then you would get a clean Q-tip to get the edges. Depending on what your doctor's order said, for this one we're just doing a dry, sterile dressing change. So we're going to apply some 4x4s. This is to collect the drainage. And place those on the wound. You may have to scoot that down a little bit once you get it covered. You're going to get your ABD pad. It always comes with a line down the center. That's to let you know when it gets saturated. I'm going to cover that. And then you just secure your dressing with your tape. If the patient was allergic to tape, we would use paper tape or a sensitive tape. You're going to secure your dressing on each end. Just be aware and cautious that the patient is sore in this area. So when you're applying the tape, you don't want to do a lot of pressing. You want to make sure the tape is secure. As you're doing the dressing change, you want to always observe and notice how the patient is tolerating the procedure. So you can document that when you finish. Okay, so once you get it covered, you want to date and time the dressing so the next nurse will know when it needs to be, when it was changed last. And get rid of all your supplies. Cover your patient up. You want to ask the patient if they need to be put in a more comfortable position. Then you would just clean up your supplies. And lastly, you would document the dressing change, date, time, what the old dressing looked like, how much drainage was on it, any odor that you noted. Then you would also document the observation of the wound itself. You would measure the size, what the wound bed looked like. Thank you.